Okay, so hello everybody. Today we will be studying head and neck from the Grey's Anatomy for Students book, and this book is just a great overview. Like for the exam preparation, this is great. So without further ado, let's get started. Okay, the head and neck are anatomically complex areas of the body. Yeah, we all know that. The head is composed of a series of compartments formed by bone and soft tissues. They are the cranial cavity. Yes, makes sense. Uh, uh Cranial cavity, two ears, orbits, nasal cavity, oral cavity, blah blah blah. Okay. Cranial cavity is the largest compartment, contains the brains and associated membranes. Okay. Most of the ear apparatus on each side is contained within one of the bones, forming the floor of the cranial cavity. Yes, the external parts of the ears extend laterally from these regions. Okay, ears are outside. Wow, I didn't know this. So, what they're talking about here, one of the bones forming the floor of the cranial cavity. This is I think, the pterygoid part of the temporal bone. Yes, but I think we will come back to this in more details. The two orbits contain the eyes. Yep, orbits. They are cone-shaped chambers immediately inferior to the anterior aspect of the cranial cavity. So these are cone-shaped orbits. Yeah, makes sense. And the apex of each cone is directed posterior-medially. Okay, it is directed posteriorly and medially. Posteriorly and medially. Walls of the bone. The walls of the orbits are bone, whereas the base of each conical chamber can be opened and closed by the eyelids. Yeah, this is the front. The nasal cavity is the upper parts of the respiratory tract and is between the orbits. Nasal cavities are the upper parts of the respiratory tract. Okay. Yeah, the respiratory tract starts at the nose and goes to the lungs. Yeah, so here is the nose. Wow. They have walls, floors, ceilings, which are predominantly composed of bone and cartilage. Yes, the anterior openings to the nasal cavities are nares. Okay, the outside. These are the nares. And the posterior openings are choanae, posterior nasal apertures. Yeah, so these here are the choanae, and they're extremely well visible on the skull as well, I think. The skull specimens. Continuous with the nasal cavities are air-filled extensions, paranasal sinuses. Yes, which project laterally. Okay, so here is the nasal cavity, which project laterally from it. So in both directions, like right and left, these are air-filled extensions, paranasal laterally, superiorly, and posteriorly. Okay, and maxillary sinuses are inferior. So I think laterally they are talking about this nasal cavity itself, and then superiorly is the frontal sinus, posteriorly is the sphenoidal sinus, and the surrounding bone. The largest maxillary sinuses are inferior. Yeah, makes sense. But we don't need to know this right now. It will come later. Oral cavity is inferior to the nasal cavities. Yeah. Whoa, oh no! I didn't know this. And separated from them by the hard and soft palates. The floor of the oral cavity is formed entirely of soft tissue. That is, the floor is formed by muscles, but we'll get to this. The anterior opening to the oral cavity is the oral fissure. The anterior opening to the oral cavity. Okay. The mouth is the oral fissure, and the posterior opening is the oropharyngeal isthmus. I think isthmus is mostly opening. Unlike the nares and choanae, which are continuously open, both the oral fissure and the oropharyngeal isthmus can be open and closed. Yeah, mouth can be closed, and also the oropharyngeal isthmus, which is at the back, can be closed by the epiglottis. Okay, other anatomically defined regions. In addition to the major compartments of the head, two other anatomically defined regions, infratemporal fossa and pterygopalatine fossa of the head on each side are areas of transition from one compartment of the head to another. The face and scalp, infratemporal fossa and pterygopalatine fossa of the head on each side, areas of transition from one compartment of the head to another. Okay, these are areas of transition. The face and scalp are also anatomically defined areas of the head and related to external surfaces. Makes sense. Infratemporal fossa is an area between the posterior aspect of the ramus of the mandible and a flat region of bone, the lateral plate of pterygoid process. Okay, so this is the ramus of the mandible. Yeah, and this, which I have already highlighted, was this is the lateral plate of the pterygoid process. So the space here, inside this bone but outside this bone, is the infratemporal fossa, just posterior to the upper jaw. This fossa, bounded by bone and soft tissues, is a conduit for one of the major cranial nerves, the mandibular nerve, mandibular division of the trigeminal nerve. This is V3. So this whole area is the infratemporal fossa. Makes sense. This area is the infratemporal fossa, and they conveniently labeled it here as well. I didn't see it. V3, which passes between the cranial and oral cavities. Mandibular nerve V3. Okay. So the trigeminal nerve has three. This is the trigeminal nerve. This has V1, V2, and V3 divisions. V1 is ophthalmic. V2 is so this is the maxilla, so maxillary, and this is the mandible, so this whole should be the mandibular nerve. V3 of trigeminal. V is 5 for trigeminal. The pterygopalatine fossa on each side is just posterior to the upper jaw. This small fossa communicates with the cranial cavity. So now they're talking about pterygopalatine fossa, which is this one here. So the pterygopalatine fossa communicates with the cranial cavity. Yes, it does. So there are small openings here and here and here, which allow it to communicate with the cranial cavity. So one of these is for the cranial cavity. The infratemporal fossa, I think this is the I forgot. Foramen rotundum ovale spinosum. So this is the foramen rotundum. The small fossa communicates with the cranial cavity. The infratemporal fossa, yes. Oh, it communicates with the infratemporal fossa. Yeah, I can see the connection here. The orbit, I can see connection here. This is the superior ophthalmic fissure, I think. So this is inferior. Superior opens into the cranial cavity. Inferior ophthalmic fissure, and the infratemporal fossa, the orbit, the nasal cavity. I forgot, but there has to be something here. I think these communicate with the nasal cavity and the oral cavity. Yeah, from the inside some way. I don't know, but they do. So the five openings: the cranium, the infratemporal fossa, the orbit, the nose, the nasal cavity, and the mouth. A major structure passing through the pterygopalatine fossa is the maxillary nerve. So this was mandibular passing through V3. This is the um, maxillary nerve V2. Here it can be seen as well. Okay. Okay, this is the scalp. Orbicularis oculi are the muscles surrounding the eye, and this is the orbicularis. Oris surrounding the mouth. Oris, mouth, oculi, like eyes, I think, and face. Oh no, I didn't know this was the face. Anyways, the face is the anterior aspect of the head and contains a unique group of muscles that move the skin relative to the underlying bone and control the anterior opening to the orbits and oral cavity. Scalp covers the superior, posterior, and lateral regions of the head. So superior region, posterior region, and lateral regions. Oh yeah, but not anterior. So superior, lateral, and posterior. I think anteriorly we do have, but yeah, I think this is superior. Then we come to these muscles, and this is different. Neck extends from the head above to your shoulders and the thorax below. Neck extends from the head above. Yes, so this should be the neck from the head above to the shoulders and thorax below. So this area is the neck. Its superior boundary is along the inferior margin of the mandible. Okay, so now we're getting into the details. Inferior margin of the mandible. Yeah, maxilla, mandible. And bone features in the posterior aspect of the skull. Okay, so inferior margin of the mandible and the bony features of the skull, like the mastoid process, etc. Yeah. And then the posterior neck is higher than the anterior neck. The posterior neck is higher than the anterior neck to connect cervical viscera with the posterior opening of the nasal and oral cavities. So posteriorly the neck is higher, but anteriorly the neck is lower. With the posterior opening of the nasal and oral cavities. Okay, so viscera have to be connected to the nasal and oral cavities. So this is why here we take the neck at this level, but posteriorly the neck is at the level of vertebra C7, I think. Yeah. The inferior boundary of the neck extends from the top of the sternum. Yes, so this is the manubrium of the sternum. The manubrium is here. This is the rest of the sternum, and this is the xiphoid process. Manubrium of the sternum along the clavicle, along both the clavicles, and onto the adjacent acromion. This is the acromion of the scapula. Yes, posteriorly the inferior limit of the neck is less well defined, but can be approximated by a line between the acromion and the spinous process of vertebra C7. Okay, so from the acromion we go to the vertebral processes of the vertebra C7 here. So this is our posterior boundary. Same acromion, vertebral process of the vertebra C7, and this is our posterior boundary, which is prominent and easily palpable. Yeah, C7 is the vertebra prominence, which is prominent and easily palpable. Inferior border of the neck encloses the base of the neck. Compartments. The neck has 4 major compartments which are enclosed by an outer musculofacial collar. The neck has 4 major compartments which are enclosed by outer musculofacial collar. Okay. Vertebral compartment. This one contains the vertebrae and the muscles surrounding them. Yes. The visceral compartment contains important glands. So visceral, yeah. Parietal is like this. I think will be important in the thorax and other stuff, but the visceral, no, the parietal is on the wall, and the visceral is like the organs inside the wall. So viscera are the organs, like structures passing through this cavity are the viscera. The visceral compartment contains important glands: the thyroid gland, parathyroid gland, thymus gland, and parts of the respiratory and digestive tracts that pass between the head and the thorax. Two vascular compartments, one on each side, contain the major blood vessels in the vagus nerve. Two vascular compartments, one on each side, contain the major blood vessels in the vagus nerve. This is the vascular compartment enclosed by the carotid sheath, which contain the major blood vessels and the vagus nerve as well. This is the visceral compartment. Yes. Larynx and pharynx. The neck contains two specialized structures associated with digestive and respiratory tracts. The larynx, which is the voice box, associated with the respiratory tract, and the pharynx, which is I think common for both of them. So yeah, this complete area is the pharynx, but the larynx is like a small tiny compartment over here. This is also true. Pharynx is like the muscular wall thingy, and the larynx it should be here. Okay, they didn't label it, but this is the larynx. The larynx is the upper part of the lower airway. Upper part of the lower airway. Yeah, just inferior to the larynx is the trachea. So just above the trachea is the larynx, makes sense, and is attached below to the top of the trachea and above by a flexible membrane to the hyoid bone, which in turn is attached to the floor of the oral cavity. So the larynx is attached below to the top of the trachea, but above it is attached to the hyoid bone. Yeah, okay, so this is the larynx. Here should be the hyoid bone. So the hyoid bone is attached to the base floor of the oral cavity. A number of cartilages form a supportive framework for the larynx, which has a hollow central channel. Yeah, makes sense. Larynx should have a hollow central channel. Cartilages also. This is the thyroid cartilage, cricoid cartilage. Makes sense. There should be more cartilages, but yeah, we'll get into that later. The dimensions of the central channel of the larynx can be adjusted by soft tissue structures associated with the laryngeal wall. The most important of these two are the lateral vocal cords, which project toward each other from adjacent areas of the laryngeal cavity. Adjacent sides of the laryngeal cavity. The upper opening of the thorax, the laryngeal inlet, tilted posteriorly, is continuous with the pharynx. Upper opening of the larynx, the laryngeal inlet, is tilted posteriorly and is continuous with the pharynx. Oh. This is the laryngeal inlet. This is tilted posteriorly and is continuous with the pharynx. Yes, so this opens up into the pharynx. Yeah, and the vocal cords they're talking about, these. Yeah, these two are the vocal cords. The pharynx is a chamber in the shape of a half cylinder. Chamber in the shape of a half cylinder with its wall formed by muscles and the fascia. Yeah, this is the pharynx. Above the walls are attached to the base of the skull. Above the walls are attached to the base of the skull, and below to the margins of the esophagus. Yeah, above these are, here should be the skull. Yeah, so this is the base of the skull attachment. Like all of these will have some, I don't know, not ligaments. Yeah, I think ligaments connecting here and here, and inferiorly, the pharynx is attached to the esophagus. On each side, the walls are attached to the lateral margins of the nasal cavities, the oral cavity, and the larynx. Yeah, they are connected to the nasal cavities, the larynx. Yeah, oh, so this is the connection of the larynx and two nasal cavities, oral cavity, and the larynx. Yeah, makes sense. Above this, here is the oral cavity. So there could be some connections. This is the larynx. Connections here and here. And the nasal cavities, there might be some connections. I don't know. So the part of the pharynx posterior to the nasal cavities is the nasopharynx. Part of the pharynx posterior to the nasal cavities is the nasopharynx. Okay, so this complete is the laryngopharynx. Up here somewhere should be the nasopharynx. So nasopharynx. Okay, nasopharynx makes sense. Those parts posterior to the oral cavity and larynx are the oropharynx and laryngopharynx respectively. Yeah, makes sense. If this is the pharynx, nose, nasopharynx, mouth, oropharynx, and larynx, laryngopharynx. Makes sense. And this is the pharynx. Functions: protection. The head houses and protects the brain, all the receptor systems associated with special senses, the nasal cavity associated with smell. Yeah, and the olfaction with the nose, orbits with vision, ears with hearing, and balance also. Oh, I always forget balance. And the oral cavity with taste. Contains upper parts of the respiratory and digestive tracts. Yes, head contains oral and respiratory and digestive systems, the nasal and oral cavities, which have structures for modifying the food or modifying the air or food passing into each system. The head and neck are involved in communication. Sounds produced by the larynx. Oh, that communication. Modified in the pharynx and oral cavity to produce speech. Very important. In addition, the muscles of the facial expression adjust contours of the face to relay non-verbal signs. Okay, so 2. Speech and facial expressions by the head. Yeah, but this is like useless stuff. Positioning the head. The neck supports the position in the head. Importantly, it enables an individual to position sensory systems in the head relative to environmental cues without moving the entire body. Okay, movement of the head to perceive. Connects the upper and lower respiratory and digestive tracts. The neck contains specialized structures, pharynx and larynx, that connect the upper parts of the digestive and respiratory tracts. The neck contains specialized structures, pharynx and larynx, that connect the upper parts of the digestive. Okay, so pharynx connects the upper part of the digestive and larynx connects the upper part of the respiratory tracts to in the head with the esophagus and trachea below, which themselves pass into the thorax. Okay. Component parts. The many bones of the head collectively form the skull. Mm-hmm. Yeah, but this, like, oh, this is so difficult to see. Yeah, oh, this is so much better. Yeah, okay. The many bones of the head collectively form the skull, figure 8.7a. Most of these bones are interconnected by sutures. Yes, makes sense. All of these connections are sutures. Oh, no, 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 not this one. This is the orbital cavity, but still, you get the point. Okay. In the fetus and newborn, large membranous and unossified gaps, fontanelles between the bones of the skull, particularly between the large flat bones that cover the top of the cranial cavity, 8.7c, allow the head to deform during passage through the birth canal and postnatal growth of the brain. Yes, these are fontanelles. Yeah, this is the fontanelle. This is the fontanelle. Here is also a fontanelle. Anterior, lateral, and posterior lateral fontanelles, which are sphenoidal and mastoid fontanelles. Most of the fontanelles close during the first year of life. Full ossification and the thin connective tissue ligament supporting the bones at the suture line begins in the late 20s and is normally completed in the 5th decade of life. Okay, so fontanelles complete their ossification during the 50s, like this. There are only 3 pairs of synovial joints on each side of the head. The largest are the temporomandibular joints between the lower jaw mandible and the temporal bone. So this is the TMJ on the other side as well. And the temporal bone. 2 other synovial joints are between the 3 tiny bones in the middle ear, malleus, incus, and stapes. Okay, so inside the ear here, there are 2 synovial joints between 3 bones. So these 2 synovial joints. Okay, yeah, this is just memorization. Coronal suture, sagittal suture. Just remember, this is the coronal suture. And when coronal sections also come up, you can just think about this one. Coronal suture, yeah, this is the sagittal suture, lambdoid suture. I don't know why don't they call it occipital suture, but I don't know, lambdoid suture. Okay, cervical vertebrae. I think I've done this one like once before. Yes, I think we are all done with the cervical vertebrae once, but I think it's just better to go over it once more. 7 cervical vertebrae from the bony framework of the neck. This cervical vertebrae are characterized by small bodies. Yeah, so cervical vertebrae, we are talking about the top cervical vertebrae. They have small bodies, bifid spinous processes. So spinous processes have like 2 we can where we can see okay, I don't, never mind. But they have like spinous bifid processes. They are like divided into 2 at the back. The transverse processes contain a foramen, the foramen transversarium, or the transverse process. This one contains the foramen transversarium. Here, the vertebral artery ascends, but you don't need to know it right now. Not like at this very moment. Together, the foramina transversaria form a longitudinal pass on each side of the cervical vertebral column for blood vessels, the vertebral artery and veins. Aha! So here the vertebral artery and veins pass. Now you need to know. Passing between the base of the neck and the cranial cavity. Yeah, so the vertebral arteries like originate here and then they pass through all these foramina and into the brain. Base of the neck and the cranial cavity. So each bone has a superior articular facet and an inferior articular facet. Superior and inferior articular facet. Superior with the one above to like join, or I don't know what should be the word, to form, I don't know, to To articulate. The good word is articulate. To articulate with the one above, and the inferior process. Superior. This is the superior articular facet. Face, you can remember it like that. Superior articular facet to articulate with the bone above, and the inferior articular facet to articulate with the bone below. Dens of axis. Dens of axis is extremely important. If you just remember this phrase, dens of axis, you will never confuse axis and atlas. If you just remember dens of axis, you can just look for a dens, you know this is the axis. The bone that does not have, you're sure that's the atlas. And you'll never confuse these names as well, like atlas and axis. That's how I remember at least. Okay, so this is the body, that is the arch, this is the arch. No, not this. This is the arch. Yeah? Here is the arch. Okay. Posterior arch, anterior arch, lateral mass, transverse processes, and foramen transversarium. Yeah, and this is easy. That's the body of the dens of axis. So axis, this is the body of the axis. Yeah, this is what I was talking about. So these two articulate with each other at, this is axis C2. This is the articular facet of axis, superior articular facet, and here should be the inferior articular facet of atlas C1, and these two articulate with each other here as well, there as well. Like, yeah, we cannot see it, but there I think they do. Superior occipital surface for occipital condyle. So the superior occipital surface of the axis C1 articulates with the occipital condyle of the brain, which is here. So this is the atlas axis, and axis is directly above the skull. So here is the occipital condyles on the occipital bone, or like the inferior surface of the skull. You can very clearly see it. C1 atlas has this superior articular facet which articulates here. Okay, articular facet for dens. Tectorial membrane, upper part of the posterior longitudinal ligament. Oh yeah, okay, so this posterior longitudinal membrane continues like this, but they cut it to show the structures. Posterior longitudinal ligament. Occipital bone is here. This is what I was talking about, the occipital condyle here. So this is a posterior view. If you're looking at someone from the back, this should be the posterior view. Apical ligament of dens of axis. Yeah, this is the apical ligament at the top of the dens. That's the occipital condyle. Transverse ligament of atlas. Yeah, okay, so atlas axis. This is the atlas buried deep here, and this is the transverse ligament. Transverse ligament, apical ligament, alar ligament. Ala is wing. So these look a little bit like wings. I don't know. And anatomists are extremely creative. Yeah, they're too creative for their own good, but okay. Superior longitudinal band of cruciform ligament. Yeah, inferior longitudinal band of cruciform ligament. So cruciform ligament should also continue, but it does not. So the cruciform ligament is divided into the superior and inferior parts, or the superior and inferior longitudinal bands, if you want to be more articulate. Superior longitudinal bands of cruciform ligament, inferior longitudinal band of cruciform ligament, and then at the top are the posterior longitudinal bands, and these are all the ligaments in the formation of the occipital C1 and C2 articulation. Yep. Typical transverse process. Yeah. Okay. So this green stuff, like we are not supposed to know this, but I just read it for like uh, fun facts from history. But yeah, fun facts from the clinical practice, not history. Typical transverse process of cervical vertebra also has anterior and posterior tubercles for muscle attachment. The anterior tubercles are derived from the same embryological elements that give rise to ribs in the thoracic region. Occasionally, cervical ribs develop from these elements, particularly in association with the lower cervical vertebrae. The upper two cervical vertebrae C1 and 2 are modified for moving the head. Yeah, so C1 and 2 are unusual because they have to move the head. So C3 to C7, yeah, they're yeah, C7 is also a little bit different, but C6 is definitely, C3 to 6 are definitely like the normal cervical bones or cervical vertebrae, I should say. The hyoid bone is a small U-shaped bone. Ah, yeah, this is great, and this will be like extremely important in the neck because so many muscles attached to this bone. Small U-shaped bone. This one oriented in the horizontal plane just superior to the larynx, where it can be palpated and moved from side to side. This here should be the larynx, and the hyoid bone is here. I don't know what it's doing outside here, but okay. Hyoid bone has a body. This is the body of the hyoid bone. Is anterior and forms the base of the U. Makes sense. Anterior, the two arms of the U greater horns project posteriorly from the lateral end. This is the greater horn. This is the greater horn, and two little lesser horns are also present on the hyoid bone. Hyoid bone does not articulate directly with any other skeletal elements in the head and neck. The hyoid bone is a highly movable and strong bony anchor for a number of muscles and soft tissue structures in the head and neck. Significantly, it is at the interface between three dynamic components. Superiorly, it is attached to the floor of the oral cavity, inferiorly attached to the larynx, and posteriorly it is attached to the pharynx. Yes, so hyoid bone does not articulate with any bone. Superior, so this should be the hyoid bone. Makes sense. Above it is the floor of the orbital cavity. Below it, or posteriorly, or sorry, inferiorly is the larynx, and posteriorly is this muscle. Oh, so this is the hyoid bone. This is the hyoid bone. So superiorly is the floor of the oral cavity. Inferiorly is the larynx. Posteriorly is the pharynx. Yeah, middle pharyngeal constrictor muscle, blah 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 blah. But yeah, pharynx is posterior to it. That's it. Okay, soft palate is a soft tissue flap-like structure hinged to the back of the hard palate. 8.10a. Yeah, I know what the soft palate is. 8.10. Oh, okay. Yeah, here should be the soft palate. Here is the hard palate at top of our mouth, and posterior to it is the soft palate. Yeah. With a free posterior margin, it can be elevated and depressed by muscles. Makes sense. It is soft. It is made up of mucosa and muscles, ligaments, etc. Soft palate and associated structures can be clearly seen through an open mouth. Yeah, you can all see your soft palate. So like, no, not like this. So something like this and this should be visible. No. Something like this should be visible. Muscles. The skeletal muscle of the head and neck can be grouped on the basis of function, innervation, and embryological derivation. Skeletal muscles of the head and neck can be grouped on the basis of function, innervation, and embryological innervation. In the head, the muscle groups in the head include the extraocular muscles, move the eyeball and open the upper eyelid. Extraocular muscles move the eyeballs. Yeah, muscles in the middle ear adjust the movement of the middle ear bones. Makes sense. Muscles of facial expression move the face. Muscle of mastication chew. Muscles of the soft palate elevate and depress the palate. Yeah. Muscles of the tongue move and change the contour of the tongue. Wow. In the neck, major muscle groups include muscles of the pharynx, muscles of the larynx. Pharynx is the common passageway. The larynx is for the passageway to the respiratory tract. Strap muscles position the larynx and hyoid bone in the neck. Yeah, because they are like straps, they hold one thing against another. Muscles of the outer cervical collar move the head and upper limb. And the postural muscles in the muscular compartment of the neck position the head and neck. We don't really need to know all of this, just understand that there are so many muscles. We'll learn each muscle, what they're talking about. Muscles of the outer cervical collar, this is so vague. Postural muscles in the muscular compartment, so vague. We'll learn every muscle in detail. It's not that difficult, but like, yeah, summarizing it here, just wasting words, I think. Relationship to other regions. The superior thoracic aperture, thoracic inlet, opens directly into the base of the neck. Okay, so the superior thoracic aperture is the thoracic inlet, which opens into the base of the neck. Makes sense. Yeah, I think we're already done. Yeah, this is the thoracic inlet. Here is the thorax, above it is the neck, which shouldn't be a problem. Structure passing between the head and thorax pass up and down through the superior thoracic aperture and the visceral compartment of the neck. Yeah, the important thing is visceral component, because the neck has like the vertebral, no structures, like the structures that do pass through don't like communicate with the thorax in that manner. This is the visceral compartment, and these are the carotid compartments, or the vascular. I think vascular and the visceral are important for us for studying the thorax, I think. At the base of the, yeah, and this communicates with the back, so I think we're already done with the back. We don't need to do something about this right now. Trachea is immediately anterior to the esophagus, which is directly anterior to the vertebral column. Trachea is immediately anterior to the esophagus. Okay, so trachea is here, esophagus is here, and the vertebral column with all of this is here. Trachea, esophagus, and vertebra. Yeah, that's what they're saying. The major arteries, veins, and nerves anterior and lateral to the trachea. So this is the carotid sheath, but yeah, okay, so this is the carotid compartment, I would say, and these are lateral to the trachea, anterior and lateral. This is the vertebra and all the muscles. This is the esophagus, this is the trachea. This relationship is shown here: anterior lateral, anterior and lateral, anterior and lateral. Yeah, upper limb, this is an axillary inlet gateway to the, there is an axillary inlet gateway to the upper limb on each side of the superior thoracic aperture at the base of the neck. Axillary inlet here, and this, all of this is going to the arm. Vertebral body, esophagus, trachea, and these vessels are anterolateral to the trachea. Structures such as blood vessels pass over rib 1 when passing between the axillary inlet and the thorax. Okay, so this is the rib 1, and structures are passing over it. Yeah, makes sense. But under the clavicle, as you can see. Cervical components of the brachial plexus pass directly from the neck through the axillary inlets to enter the upper limb. Cervical components of the brachial plexus pass directly from the neck through the axillary nodes to enter the upper limb. Key features: vertebral levels C3, 4, and 5, 6. In the neck, two important vertebral levels are not so important, but I still read it. Between C3 and 4 are approximately the superior border of the thyroid cartilage of the larynx, which can be palpated, where the major artery on each side of the neck, the common carotid artery, bifurcates into internal and external carotid arteries. So this should be C3 and 4 level. Carotid. This is the common carotid artery. This one is the internal, which gives no branches, and this is the external, which gives off some branches, external. Between C5 and C6, which marks the lower limit of the pharynx and larynx, and the superior limit of the trachea and esophagus. Okay, here at this level, the pharynx and larynx end and the trachea and esophagus start. Makes sense? And the indentation between the cricoid cartilage of the larynx and the first tracheal ring can be palpated. The internal carotid artery also has no branches in the neck. Yeah, that's what I just said. So this is easy to identify. Internal carotid artery, no branches. External carotid artery gives off some branches, so you can see the difference. In a sense, the skull to supply much of the brain. It also supplies the eye and the orbit. Other regions of the head and neck are supplied by branches of the external carotid artery. Airway in the neck. The larynx and the trachea are anterior to the digestive tract in the neck and can be accessed directly when upper parts of the system are blocked. Yeah, cricothyrectomy, we don't need to know this. Blah blah blah. Tracheothyrectomy. Yeah, so what they're saying is cricoid ligament here can be like ruptured, and a tube can be inserted here for airway access. Yeah. Ooh, cranial nerves. Okay, yeah, this is a little difficult, but not that difficult. Cranial nerves. There are 12 pairs of cranial nerves, and the defining features that they exit the cranial cavity through the foramina or fissures. What I would recommend is like at least know all the rote memorize. There is no explanation here. Just rote memorize all the names of the cranial nerves here. 8, 9, 10, 11, and 12. So yeah, just rote memorize this stuff and you'll be fine. And it's like very important for them to ask questions about this. But right now, the most important, like in this head and neck region, not like the neuroanatomy stuff, in the head and neck region, I think C5 is more important, C7 is important, C9 is important, C10 is important, C11 is important, and C12 is important. But okay, we'll get into the details later. All cranial nerves innervate structures in the head and neck. Yeah, all cranial nerves innervate structures in the head and neck, but the vagus, in addition, descends through the neck and thorax and abdomen, where it innervates the viscera as well. The vagus goes until the stomach here. So I don't know where vagus is right now. Yeah, this is the vagus. This is the vagus. It comes from the head and neck, goes all the way down to the stomach, gives some branches during its way, goes all the way down to the stomach and innervates the stomach as well. Parasympathetic fibers in the head are carried out of the brain as part of the 4 cranial nerves. Parasympathetic, oculomotor 3, facial nerve 7, glossopharyngeal nerve, and the vagus nerve. The most important for us are the facial nerve 7 parasympathetic, 9 parasympathetic, and vagus nerve 10 parasympathetic. Sympathetic, when you hear the word sympathetic, think lion. That's it. That's all you need to know. Sympathetic, lion. Sympathetic, lion. Sympathetic, lion. Sympathetic means if you see a lion, you'd want to run, fight and flight. Your blood pressure rises, heart rate rises, your stomach, your digestion stops. You stop, you salivate, but a lot less. So everything that's important for your survival is by the sympathetic. The parasympathetic, these ones are like rest and digest. When you're at your couch, don't think of the lion. So if you're not thinking of the lion, you're thinking of the couch. You're at your home, chilling, relaxing, and like watching TV. And the facial nerve, glossopharyngeal, and the vagus nerve will activate the parasympathetic. Parasympathetic. Okay, so parasympathetic nervous system. This makes sense. Parasympathetic like lowers your heart rate, lowers your blood pressure, increases your digestion, and like all of that stuff. So it makes sense that vagus goes to the stomach to innervate it as well, but also gives other branches. Okay, parasympathetic fibers in the oculomotor nerve, the facial nerve, glossopharyngeal are destined for tissues in the head. Leave these structures and destined with branches of the trigeminal nerve. Trigeminal nerve 5. The vagus 10 leaves the head and neck to deliver the parasympathetic fiber to the thoracic and abdominal viscera. Example, stomach. Not just stomach, but an example is stomach is also innervated by the vagus nerve. Okay, so cervical nerves. There are 8 cervical nerves, C1 to 8. Yeah, we know that. C1 to 7 emerge from the vertebral canal above the respective vertebrae. But there are only 7 vertebrae. Where does the 8th one come from? Emerges between the vertebrae C7 and T1. Okay. C1 to 7 emerge from the respective vertebral canal above the respective vertebrae. Okay. C1 here. So this is the C1 atlas. C1 nerves come here. Axis, C2 nerves come here. A nerve comes from here. C7 comes from here. This is C7 and this is T1 now. C8 comes from here. And then also T1 comes from here. The anterior rami of C1 to 4 from the cervical plexus. The major branches from this plexus supply the strap muscles, the diaphragm, phrenic nerve, skin on the anterior and lateral parts of the neck, and skin on the upper anterior thoracic wall, and skin on the inferior parts of the head. C1 to 4. Cutaneous nerves. Yeah, these also form, one of these is also the phrenic nerve, which goes to innervate the diaphragm. Skin on the anterior and lateral aspects of the neck, anterior aspect of the neck and lateral aspect of the neck. Yeah, skin on the upper anterior and thoracic wall. So these cutaneous nerves also innervate the skin over a little bit here, on the inferior parts of the head, and skin on the inferior parts of the head. Yeah, so inferior parts of the head as well. Some of these are going up, so some here. Anterior rami of C5 to 8 together with a large component of the anterior ramus of T1 from the brachial plexus. C5 to 8 and T1 form the brachial plexus. C1 to 4 form the cervical plexus. C5 to T1 from the brachial plexus. And we can see the phrenic nerve somewhere here. Oh, so this is the phrenic nerve going downwards like this, coming from C3, 4, and 5. Okay, brachial plexus, which innervates the upper limb, muscles and skin and blah 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 in the upper limb. Functional separation of the digestive and respiratory tracts. The pharynx is a common chamber for the digestive and respiratory tracts, as we have established. Consequently, breathing can take place through the mouth as well as through the nose. And material from the oral cavity can potentially enter either the esophagus and the larynx. Importantly, lower airway can be accessed through the oral cavity by intubation. So you open your mouth and you theoretically can access the respiratory cavity and also the digestive cavity, or the digestive tract can be accessed through the nasal cavity by feeding tubes. So the nasal cavity can also theoretically open here in the digestive tract. Normally, the soft palate epiglottis in the soft tissue structure within the larynx act as valves to prevent food and liquid from entering lower parts of the respiratory tract, which is amazing. 8.16a. Yeah, this is what they're trying to do here. This is the soft palette, opens and closes. Also, yeah, that's the hard palette. Here, oh, here is the hard palette. This is the soft palette behind it, and also the epiglottis should be labeled here. Yeah, I don't see it. Okay. Oh yeah, epiglottis here. During normal breathing, the airway is open and air passes free. During normal breathing, airway is open and air passes freely through the nasal cavities or oral cavity, pharynx, larynx, and trachea. The lumen of the esophagus is normally closed because, unlike the airway, it has no skeletal support structures to hold it open. The trachea has cartilaginous C-shaped rings. We can always see them on drawings like these, like this, like this, like this, like this. But that's not C-shape because this is a schematic drawing. Let me find the trachea. Yeah, here. So this, these are the C-shaped rings. C-shaped ring, and posteriorly is the trachealis muscle. When the oral cavity is full of liquid or food, the soft palate is swung down, depressed to close the oropharyngeal isthmus, thereby allowing manipulation of food and fluid in the oral cavity while breathing. Yeah, soft palate closes the oropharyngeal isthmus. Makes sense? When swallowing, the soft palate and parts of the larynx act as valves to ensure proper movement of food from the oral cavity into the esophagus. Ensure proper movement of food from the oral cavity into the esophagus. Soft palate elevates to open the oropharyngeal isthmus, while at the same time sealing off the nasal part of the pharynx from the oral part. This prevents food and fluid from moving upward into the nasopharynx as well and the nasal cavities. Epiglottis of the larynx. Yeah, epiglottis closes the laryngeal inlet, and much of the laryngeal cavity becomes occluded by the opposition of vocal folds and soft tissue folds superior to them. In addition, the larynx is pulled up and forward. Larynx is pulled up and forward to facilitate the moving of food and fluid over and around the closed pharynx and into the esophagus. In newborns, the larynx is high in the neck and the epiglottis above at the level of the soft palate. Babies can therefore suckle and breathe at the same time. Liquid follows around the larynx. Liquid goes here, but the larynx is like a huge hill. So the liquid can go and the larynx breathing can also take place without any danger of entering the airway. During the second year of life, the larynx descends into the low cervical position characteristic of adults. Triangles of the neck, the two muscles, the trapezius and the sternocleidomastoid muscles. This is the sternocleidomastoid, it is a big muscle, and this is the trapezius muscle that form part of the outer cervical collar, divide the neck into anterior and posterior triangles on each side. Anterior to the sternocleidomastoid and the other sternocleidomastoid is here the anterior triangle, and between the sternocleidomastoid and the trapezius muscle is the posterior triangle. Boundaries of each the anterior triangle are the median vertical line of the neck, so in between the inferior margin of the mandible here, and the anterior margin of the sternocleidomastoid muscle here. So this inferior margin of, so one side, inferior margin of the mandible, the midline, and the sternocleidomastoid muscle. Inferior margin of the mandible, midline, and sternocleidomastoid muscle. This is anterior triangle on the, like for example, this is the left side, so, but the same on the right side. Here in the posterior triangle, yeah, this is the posterior triangle. So sternocleidomastoid muscle, middle 1/3 of the clavicle, and the trapezius muscle. Middle 1/3 of the clavicle, anterior margin of the trapezius, anterior margin of the trapezius, and the posterior margin of the sternocleidomastoid. Anterior margin of the sternocleidomastoid, posterior margin of the sternocleidomastoid. Major structures that pass between the head and the thorax can be accessed through the anterior triangle. Head and the thorax, anterior triangle. Posterior triangle part lies over the axillary inlet. and associated with the structured nerves and vessels that pass into and out of the upper limb. So this is associated with the structures that pass between the upper limb. Yeah, makes sense. Regional anatomy. Okay. The skull has 22 bones. Nobody asked that, including the ossicles of the ear, except for the mandible, which forms the lower jaw. The bones of the skull are attached to each other by sutures, are immobile, and form the cranium. Only the mandible is allowed to move freely with a synovial joint. Cranium can be subdivided into the upper domed part, calvaria. So this is the calvaria. I mean, this part is the calvaria. Yep, upper domed part, which covers the cranial cavity containing the brain, a base that consists of the floor of the cranial cavity, and a lower anterior part of the facial skeleton. So here is the calvaria, or in the lateral view. This is the calvaria. This is the base, and this is the viscerocranium, or the face. Bones forming the calvaria are mainly the temporal and parietal bones. Bones forming the calvaria are mainly the temporal and parietal bones. Okay, yeah, the temporal, parietal bones, and parts of the unpaired frontal, sphenoid, and occipital. Frontal bone, sphenoid bone, and the occipital bone, we cannot see it here, we have to see it here. Frontal bone, just let me erase everything. Frontal bone forms the calvaria. Parietal bone forms the calvaria. Temporal bone forms the calvaria. Occipital bone forms the calvaria. Sphenoid bone forms the calvaria. The bones forming the base of the cranium are mainly parts of the sphenoid, temporal, and occipital bones. So the base of this is the superior view. Yeah, mainly the sphenoid. Yellow is the sphenoid here, temporal, and the occipital. This is the base formed by these three, mostly these three bones, but some other bones here, but we'll not go into the details right now. But the details are coming, don't worry. Bones forming the facial skeleton are paired of the comprised of the nasal bones, palatine bones. Okay. Yeah, this is interesting. Bones forming the facial skeleton are the nasal bones. This one, nasal. Palatine bones, posteriorly. Yeah, I don't think we can see the palatine bones here, but from the inferior view, yeah, they're so much better. So these are the palatine bones. This also contributes to the formation of the face, not just the external skull base. Palatine bones. Lacrimal bones are here. This is the lacrimal bone. Zygomatic bones. These are the zygomatic. Yeah, zygomatic bone. This. Maxillae. So this is the maxilla and this is the maxilla. Where is it labeled? Yeah, maxilla. An inferior nasal concha and the unpaired vomer. This is the inferior nasal concha. You can see it on some of our skulls in the lab as well. Inferior nasal concha and the unpaired vomer. Where is the vomer? Oh, here. Nasal crest comes from the vomer, but why didn't they label the vomer? Yeah, I don't see it. I don't know, but here should be the vomer. Nasal crest is formed by the bone vomer. Oh, no. This is the vomer, I think. No, this is the nasal crest. Yeah, this is the vomer. Yeah. The mandible is not part of the cranium nor part of the facial skeleton. Mandible is a different beast. Okay. Anterior view. Anterior view of the skull includes the forehead, this thing, superiorly and inferiorly the orbits and the orbits, nasal region, part of the face between the orbit and the upper jaw. Between the nasal cavities and the upper jaw and the lower jaw. Okay, frontal bone. The forehead consists of the frontal bone, which also forms the superior part of the rim of each orbit. Just superior to the rim of each orbit. Just superior to the rim of the orbit on each side are the raised superciliary arches. These. Why didn't you label anything here? I don't know. Okay, so this is the lacrimal bone. Here you cannot see the vomer, but okay, what can I do? Superciliary arches. These are more pronounced in men than in women because these arches is a small, between these arches is a small depression, the glabella. This one. Yeah, okay, so yeah, this is the superciliary arch label. Yeah, so this is the superciliary arch and this is the glabella. Clearly visible in the medial part of the superior rim of each orbit is the supraorbital foramen. Supraorbital foramen or notch here. Medially, the frontal bone projects inferiorly, forming part of the medial rim of the orbit. Medially, the frontal bone projects inferiorly. Medially, so this is medially. The frontal bone, this one, projects here inferiorly and medially to form this, the nasal part of the frontal bone, forming the medial rim of the orbit. So yes, medial rim, but inside as well, the medial rim of the orbit. So here, yeah, medial rim of the orbit and also the inferior, the nasal process of the frontal bone. Laterally, the zygomatic process of each frontal bone projects inferiorly, forming the upper lateral rim. Zygomatic process, this, of the frontal bone. This. Projects inferiorly, forming the upper lateral rim of the orbit. Yes, this process articulates with the frontal process of the zygomatic bone. Okay, so this is zygomatic bone, it has a frontal process. And this is the frontal bone, it has a zygomatic process. And both of these meet, or by a suture. The frontal process, the zygomatic bone. Zygomatic and nasal bones. The lower lateral rim of the orbit as well as the lateral part of the inferior rim of the orbit is formed by the zygomatic bone. Zygomatic, the lateral part and the lower lateral part is formed by the zygomatic bone. Makes sense. The cheekbone. Superiorly in the nasal region, the paired nasal bones. Superiorly in the nasal region, the paired nasal bone articulate with each other in the midline. And with the frontal bone superiorly, the center of the frontonasal suture formed by the articulation of the nasal bone and the frontal bone is called the nasion. Here is the nasion. These are the frontal bones. Laterally, each nasal bone articulates with the frontal process of each maxilla. Maxilla, frontal process of the maxilla, frontal process of the maxilla, nasal bone articulates here. Frontal process of the maxilla, frontal process of the maxilla, nasal bones articulate here. So simple, okay? Inferiorly, the piriform aperture is the large opening in the nasal region and the anterior opening of the nasal cavity. It is bounded superiorly by the nasal bones and laterally and inferiorly by each maxilla. Piriform aperture, you can see here, piriform aperture, the opening of the nasal cavity, bounded superiorly by the nasal bones, laterally by the maxillae, inferiorly also by the laterally and inferiorly by the maxillae or maxilla. I think maxillae because they fuse together in this region. So yeah, two maxillae join to form one. Visible through the piriform aperture are the fused nasal crest forming the lower part of the bony nasal septum and ending anteriorly at the anterior nasal spine, and then and the paired inferior nasal conchae. This is the inferior nasal concha. This is the anterior nasal spine. And this opening is the piriform aperture. Anterior nasal septum are fused in nasal crests. Oh yeah, this one, nasal crest. This one is the nasal crest. Maxillae. Part of the face between the orbit and the upper teeth and the upper jaw is formed by the paired maxillae. Maxilla, mandible. Maxilla is up, mandible is down. Yeah, max. So it's the top, most, upper, like maximum something. So maximum should be at the top. Mandible is not maximum, so it should be at the bottom. That's how I remember it. You don't have to. Superiorly, each maxilla contributes to the inferior and medial rim of the orbit. Each maxilla contributes to the inferior and medial rims of the orbit. Yeah? Maxilla, inferior and medial rims of the orbit. Superior and lateral inferior rims are by the frontal and maxillae, by the zygomatic bone. Here is the medial and inferomedial, I would say, by the maxillae of the orbit, the openings of the orbit. Laterally, the zygomatic process of each maxilla articulates with the zygomatic bone, and medially, the frontal process of each maxilla articulates with the frontal bone. Laterally, the maxillae articulate with the zygomatic bone, and medially, they articulate with the frontal bone. So here, frontal bone, and here, the zygomatic bone. Inferiorly, part of each maxilla lateral to the opening of the nasal cavities form the body of the maxilla. Here is the body of the maxilla. I think I saw the body of mandible. Okay, they didn't label the body of the maxilla, but yeah, here is the body of the maxilla. Okay. On the anterior surface of the body of the maxilla, just below the inferior rim of the orbit, is the infraorbital foramen. Inferiorly, each maxilla end is the alveolar process, which contains the teeth and forms the upper jaw. Okay, they're talking about these openings here, which are the infraorbital foramen. This is the orbit. Infra to it or below it is the infraorbital foramen. Makes sense. And inferiorly, the maxillae end as the alveolar process of the maxilla, which hold the teeth. This is the alveolar process of the mandible, yeah, which holds the teeth. Mandible. Lower jaw mandible is the most inferior structure in the anterior view of the skull. It consists of the body of the mandible anteriorly and the ramus of the mandible posteriorly. Body of the mandible here, ramus of the mandible here posteriorly. Yeah. These meet posteriorly at the angle of the mandible. Yeah, angle of the mandible is this one. So ramus comes here, body comes here, and they meet at the angle of the mandible. Inferiorly, okay, the visible to some extent. In the anterior view, the body of the mandible is arbitrarily divided into two parts. The lower part is the base of the mandible, upper part is the alveolar part. Yeah, lower part is the base of the mandible, and upper part is the alveolar, which holds the teeth. Arbitrarily, no reasoning whatsoever. There is a reasoning, but yeah, it doesn't hold up too well. Alveolar part of the mandible contains the teeth that is reabsorbed when the teeth are removed. So we can see this in our labs. Some people who had lost their teeth, the alveolar processes also start to be resorbed or removed. Base of the mandible has a midline swelling, the mental protuberance on its anterior surface when the two sides of the mandible come together. Just lateral to the mental protuberance on either side is slightly more pronounced mental tubercles. Mental protuberance is on the midline and slightly more pronounced here are the mental tubercles. Laterally, a mental foramen. Oh yeah, this table is extremely important. Yeah, and I think we need to know everything here. It's not so bad once you start doing it, but yeah, you have to spend some time. Like, I would say half an hour. You really have to spend external foramen of the skull. Laterally, a mental foramen is visible halfway between the upper border of the alveolar part of the mandible and lower part of the base of the mandible, blah blah blah. Continuing past this foramen is a ridge, the oblique line passing from the front of the ramus onto the body of the mandible. This oblique line is point of attachment for muscles that depress the lower lip. Oblique line. I don't know if we can see any oblique line, but this is the mental foramen. And here is the oblique line. This one is the oblique line. These muscles attach to the lip that depress the lower lip. Okay, I don't know how they can do it because this oblique line is going up. Oh, so this part. Okay. Not that part. This part of the oblique line, muscles attached to the lower lip and pull the oblique line downwards. Oh. Not the oblique line, but like the lower lip downwards. Lateral view of the skull. We have graduated. Okay, lateral view of the skull consists of the lateral wall of the cranium. Lateral view of the skull consists of the lateral wall of the cranium. Yeah, lateral view should give you the lateral wall. Come on. Which include lateral portion of the calvaria and the facial skeleton and half of the lower jaw. Lateral portions of the calvaria and the facial skeleton and half of the lower jaw. Yeah, half of the lower jaw, facial skeleton, and the calvaria. Okay, yeah, this is just one page and they're just describing stuff. So yeah, okay. Bones forming the lateral portion of the calvaria include the frontal, parietal, occipital, sphenoid, and temporal bones. Frontal, yeah, this is getting messed up. Frontal, parietal, temporal, sphenoidal, occipital bones form the lateral part. Bones forming the visible part of the facial skeleton include the nasal, maxilla, and zygomatic bones. Nasal, zygomatic, maxilla. I can also see lacrimal bone, but okay, I don't know. And the lateral part of the maxilla mandible. Lateral portion of the calvaria. Lateral portion of the calvaria begins anteriorly with the frontal bone. In upper region, the frontal bone articulates with the parietal bone at the coronal suture. Yeah, so parietal, frontal. This is the coronal suture. This is the sagittal suture, and this is the lambdoid suture. And then the parietal bone articulates with the occipital bone at the lambdoid suture. Yeah. Lower parts of the lateral portion of the calvaria, frontal bone articulates with the greater wing of the sphenoid. Yeah, here. Okay, so parietal bone and the sphenoid bone meet. The frontal bone, the sphenoid, and the parietal meet. The temporal, sphenoid, and the parietal meet. And this is known as the terion. And I think this is an important point in neuroanatomy as well. So here. Terion. Articulates with the parietal bone at the sphenoparietal suture and with the anterior edge of the temporal bone at the sphenosquamous suture. Sphenoparietal suture, frontoparietal, sphenofrontal, but yeah, they don't, this just no terion. I think that's it. Fine articulation across the lower part of the lateral portion of the skull varies between the temporal bone and the occipital bone at the occipitomastoid suture. Here, mastoid process, and the mastoid process is this part, and the parietal bone is this. So, parieto-mastoid suture. Oh, occipitomastoid. Here is the occipitomastoid suture. Yeah, occipital bone, mastoid process, occipitomastoid suture. Temporal bone. Major contributor to the lower portion of the lateral wall of the cranium is the temporal bone, which consists of several parts: the squamous zygomatic and the tympanic part. Squamous part has the appearance of a large flat plate forms the anterior and superior walls of the temporal bone, contribute to the lateral wall of the cranium, articulates anteriorly with the greater wing of the sphenoid bone at the sphenoid suture, and with the parietal bone posteriorly at the squamous suture. Blah blah blah, blah blah blah. This is the squamous part, parietal, sphenoid, parietal and sphenoid parts. Squamous part of the temporal bone. Blah 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 blah. Okay. Zygomatic process is an anterior bony projection from the lower surface of the squamous part of the temporal bone that initially projects laterally and then curves anteriorly to articulate with the temporal process of the zygomatic bone to form the zygomatic arch. This one comes anteriorly to form the zygomatic arch. So the zygomatic arch, and this is the temporal process of the zygomatic arch. This is the zygomatic process of the temporal arch. And this is the complete zygomatic arch. These two join here to form the zygomatic arch. Immediately below the origin of the zygomatic process from the squamous part of the temporal bone is the tympanic part of the temporal bone, and clearly visible on the surface of this part is the external acoustic meatus. Below the origin of the zygomatic process from the squamous part of the temporal bone is the tympanic part of the temporal bone, and clearly visible on the surface of this part is the external acoustic meatus. Opening or meatus leading to the external external acoustic opening leading to the external acoustic meatus. Right below this arch formation is this thing here, and this is the tympanic part of the temporal bone, external acoustic opening, and inside is the external acoustic meatus or the ear canal. The petromastoid part, which is usually separated into the petrous part and the mastoid part for descriptive purposes. Petromastoid part. Okay, where is this? Is the petrous part, this is the mastoid part. So between them, I think should be the petromastoid part, but I'm not sure. Or the base. Yeah, I think the base will have the petromastoid part. So mastoid part, petrous part. So petromastoid, I think. Petrous part of the temporal bone is here. So petromastoid should be here, I think. The mastoid part is the most superior part of the temporal bone. Mastoid part is the most posterior part of the temporal bone and is the only part of the petromastoid part of the temporal bone seen on a lateral view of the skull. is the most superior part of the temporal bone and is the only part of the petromastoid part of the temporal bone seen on the lateral view of the skull. Most posterior part of the temporal bone is the only part of the petromastoid part of the temporal bone seen on the lateral view of the skull. Yep, bilkul. Mastoid part is only the part. It is continuous with the squamous part of the temporal bone anteriorly. Yeah, squamous part of the temporal bone anteriorly articulates with the parietal bone superiorly at the parieto-mastoid suture. Okay, so this is the mastoid part, parieto-mastoid suture superiorly. Yeah, the mastoid part of the petromastoid part is only visible laterally. Okay. And with the occipital bone posteriorly at the occipitomastoid suture, we've seen that the two structures are continuous with each other, and the parieto-mastoid suture is continuous with the squamous suture. Yeah, makes sense. This is the squamous suture. Parieto-mastoid suture is continuous with the squamous part, the squamous suture. Inferiorly large bony prominence, the mastoid prominence projects from the inferior border of the mastoid part of the temporal bone. This is point of attachment for several muscles. Medial to the mastoid process, the styloid process projects from the lower border of the temporal bone. Okay, so mastoid process and styloid process. We can see these here: mastoid process and styloid process. Styloid, mastoid. These are attachments for muscles and ligaments. Visible part of the facial skeleton. Bones of the viscerocranium visible in a lateral view of the skull include the nasal, maxilla, and zygomatic bones. As follows: a nasal bone anteriorly. Bones of the viscerocranium visible in a lateral view of the skull include the nasal, maxilla, and zygomatic bones. Yeah, we've seen these. Nasal bone anteriorly, maxilla with the salvular process containing teeth forming the upper jaw. Anteriorly it articulates with the nasal bone. Superiorly it contributes to the formation of the inferior. Yeah, this is his description. You just read it and forget it. Just for understanding, all you need to do is like remember the picture, and you can derive all of these details from this. So just read it once and try to understand it. Medially is the frontal process articulates with the frontal bone. Laterally, zygomatic process articulates with the zygomatic bone. Blah blah blah. Zygomatic bone is an irregularly shaped bone with a rounded lateral surface that forms the prominence of the cheek. Visual centerpiece in this view. Medially it assists in the formation of the inferior rim of the orbit through its articulation with the zygomatic process of the maxilla. Superiorly its frontal process articulates with the zygomatic process of the frontal bone, assisting in the formation of the lateral rim of the orbit. Lateral is infraorbital in this view of the skull. The horizontal process forward to articulate with the zygomatic process of the temporal bone and also so form the zygomatic arch. Blah blah blah. This was blah. Usually a small foramen, the zygomatic-facial foramen, is visible on the lateral surface of the zygomatic bone. The zygomatico-temporal foramen is present in the medial deep surface of the bone. Zygomatico-temporal foramen and zygomatico-facial foramen. Zygomatico-facial should be here. So this one is zygomatico-facial. Zygomatico-temporal is on the inner surface of the zygomatic bone. The mandible. The final bony structure visible in the lateral view of the skull is the mandible. Inferiorly in the anterior part of this bit consists of the anterior body of the mandible, posterior ramus of the mandible, angle of the mandible where the inferior margin of the mandible meets the posterior margin of the ramus. Teeth are the alveolar part of the body of the mandible, and the mental protuberance is visible in this view. We've seen all of this before, it's just description. Mental foramen is on the lateral surface of the body. Superior part of the ramus, condylar, and coronoid process extend upward. Condylar process involved in articulation with the mandible with temporal bone, and the coronoid process is point of attachment for the temporalis muscle. Coronoid process. So temporalis muscle is a muscle of mastication. It starts up here and it joins here. Coronoid process. Yeah, and that's it. Condylar and coronoid processes. Yeah. This is the condylar process because it articulates, and this is the coronoid process attachment for temporalis muscle. The occipital, parietal, and temporal bones are seen in the posterior view of the skull. Occipital bone. Occasionally, the flat squamous part of the occipital bone is the main structure in this view of the skull. It articulates superiorly with the paired parietal bones at the lambdoid suture and laterally with each temporal bone at the occipitomastoid sutures. Along the lambdoid suture, small islands of bones, small sutural bones or Wormian bones may be observed. Yeah, so this is a sutural bone. Occipitomastoid. Yeah, that's squamomastoid suture. This is the lambdoid suture. Several bony landmarks are visible on the occipital bone. There is a midline projection, the external occipital protuberance, with curved lines. External occipital protuberance with curved lines extending laterally. External occipital protuberance with curved lines. Yeah? External occipital protuberance with curved lines. The superior nuchal line, inferior nuchal line, and I don't know where there's a supreme nuchal line, but yeah, some professors say there is. I don't know. With curved line extending laterally from the superior nuchal lines. Most prominent point of the external occipital protuberance is anion about 1 inch below the superior nuchal lines. Two additional lines, the inferior nuchal lines curve laterally extending is the external occipital crest. Temporal bones. Laterally, the temporal bones are visible in the posterior view of the skull, with the mastoid process being the prominent feature. On the inferior medial border of each mastoid process is a notch, the mastoid notch. Point of attachment for the inferior belly of the digastric muscle. Mastoid process is prominent. We've seen that. On the inferior medial border of each mastoid process is a notch, the mastoid notch. Oh, so here is the mastoid notch, which is the point of attachment for the inferior digastric muscle, posterior digastric, posterior belly of the digastric muscle. Superior view is so boring. The frontal bone, parietal bones, and the occipital bone are seen in the superior view of the skull at 8.21. These bones make up the superior part of the calvaria or the calva. In an anterior to posterior direction, the unpaired frontal bone articulates with the paired parietal bones at the coronal suture here. Two parietal bones articulate with each other in the midline at the sagittal suture here. The parietal bones articulate with the unpaired occipital bone at the lambdoid suture here. The junction of the sagittal and coronal sutures is the bregma. Here is the bregma, and the junction of the sagittal and lambdoid suture is the lambda. Here. The only foramina visible in this view of the skull may be paired parietal foramina, posteriorly one on each parietal bone, just lateral to the sagittal suture. Paired parietal foramina, parietal bone, here is parietal foramina. Oh yeah, parietal foramen. Parietal foramina, posteriorly one on each parietal bone, just lateral to the sagittal suture. The bones making up the calvaria are unique in their structure, consisting of dense internal and external tables of compact bones separated by a layer of spongy bone, the diplo. Inferior view. Base of the skull is seen in the inferior view and extends anteriorly from the middle incisor teeth posteriorly to the superior nuchal lines, laterally to the mastoid process and zygomatic arches. For descriptive purposes, the base of the skull is often divided into an anterior part, which includes the teeth and the hard palate. Oh, inferior part शुरू हो गया. Inferior part का anterior part, middle part which extends from behind the hard palate to the anterior margin of the foramen magnum, and the posterior part which extends from the anterior edge of the foramen magnum to the superior nuchal lines. So, anterior part, middle part, posterior part. Main feature of the anterior part of the base of the skull are teeth and the hard palate. Teeth project from the alveolar process of the two maxillae. We have read all this. The processes are together arranged in a U-shaped alveolar arch that borders the hard palate on the three sides. The hard palate is composed of the palatine process of each maxilla anteriorly and the horizontal plates of the palatine bone posteriorly. Palatine process of the maxillae. Maxilla comes up. This is the alveolar process of the maxilla, and these are the horizontal plates of the palatine bones. Paired palatine process of each maxilla meet in the middle at the intermaxillary suture. The paired maxilla and the paired parietal bones meet at the palatomaxillary suture, and the paired horizontal plates of each interpalatine suture. Intermaxillary suture, palatomaxillary suture, interpalatine suture. Several additional features are also visible when the hard palate is examined. Incisive fossa on the anterior middle and immediately posterior to the teeth, the walls of which contain the incisive foramen and the openings of the incisive canals which are passageway between the hard palate and the nasal cavity. Incisive fossa. And incisive canals here, here, there should be. Yeah, greater palatine foramen and lesser palatine foramen. Greater palatine foramen and lesser palatine foramen. Greater palatine foramen and near the posterior lateral border of the hard palate on each side will lead to the greater palatine canals. The just posterior to the greater palatine foramen and the lesser palatine foramen and the pyramidal process of each palatine bone will lead to the lesser palatine canals. The midline pointed projection, the posterior nasal spine in the free border of the hard palate. Middle part to the base of the skull is complex, forming the anterior half are the vomer and the sphenoid bones. Okay, so vomer and the sphenoid bones. Yeah, this is the vomer. That's what I'm talking about. Vomer and the sphenoid. This is the sphenoid. Forming the posterior half of the occipital and paired temporal bones. Anterior half, vomer. Anteriorly, the small vomer is in the midline resting on the sphenoid bone, contribute to the formation of the bony nasal septum, separating the two choanae. Most of the anterior part of the middle part of the base of the skull consists of the sphenoid bone, as we have seen. Sphenoid bone is made up of a centrally placed body, paired greater and lesser wings, projecting laterally from the body, and two downward projecting pterygoid processes immediately lateral to each choana. Downward projecting pterygoid processes, yeah, this and this. Body, wings, and two lateral processes. Three parts of the sphenoid bone, the body, greater wings, and the pterygoid process are seen in the inferior view of the skull. Lesser wing of the sphenoid is not seen in the inferior view. Okay. Yeah. Body of the sphenoid is centrally placed cube of bone containing two large air sinuses separated by septum sphenoidal sinus, which is posterior to the nasal cavity. We've written the name before. It articulates anteriorly with the vomer, ethmoid, and palatine bones, posterior medially with the temporal bones, and posteriorly with the occipital bone. Articulates anteriorly with the vomer, ethmoid, and palatine bones. Vomer. Oh, so this body, vomer, inside is the ethmoid and the palatine. So this is the complete sphenoid. Body is here. It articulates with the palatine bones, the vomer, and the ethmoid. Medially, posterolaterally with the temporal bones and posteriorly with the occipital. Posterolaterally here and posteriorly with the occipital bone. Extended downward from the junction of the body and the greater wings of the pterygoid processes. Each of these processes consists of a narrow medial plate and the lateral plate separated by pterygoid fossa. Each medial plate of the pterygoid process extends inferiorly in a hook-like projection, the pterygoid hamulus, and divides superior to form the small shallow scaphoid fossa. Hamulus. This is the hamulus, and this here should be the scaphoid fossa. Or inside here, scaphoid fossa. No. This is the scaphoid fossa. Superiorly, hamulus, inferiorly, or inferiorly the hamulus and superiorly the scaphoid fossa, because this is the inferior view, the skull is reversed. Yeah. Just superior to the scaphoid fossa at the root of the medial plate of the pterygoid process, the opening of the pterygoid canal. Inside here, just superior, is the opening of the pterygoid canal. Lateral to the lateral plate of the pterygoid process is the greater wing of the sphenoid. Lateral to the lateral plate of the pterygoid process is the greater wing of the sphenoid. Makes sense. Lateral plate, lateral to it is the greater wing of the sphenoid, which not only forms part of the base of the skull but also continues laterally to form part of the lateral wall of the skull. Yeah, we've seen it also. The greater wing of the sphenoid also forms the lateral wall of the skull here. This is the greater wing of the sphenoid forming the lateral wall. And here we can see it. Yeah, this is the lateral wall and this is the inferior part of the skull. Wall of the skull. It articulates laterally and posteriorly with parts of the temporal bone. We've seen it. Important features visible on the surface of the greater wing in the inferior view of the skull are the foramen ovale and the foramen spinosum in the posterior lateral border. Foramen ovale and foramen spinosum, we can find them here. Foramen ovale, foramen spinosum, foramen ovale, foramen spinosum, and this is the foramen lacerum. Outward from the upper end of the lateral plate of the pterygoid process. Posterior half. The posterior half of the occipital part of the base of the skull are occipital bone and paired temporal bones. Occipital bone is... Yeah, occipital bone is not that difficult. Cranial cavity, okay. The occipital bone, or more specifically its basilar part, is in the middle and immediately posterior to the body. The sphenoid extends posterior to the foramen magnum, is bounded laterally by the temporal bones. So this is the basilar part of the occipital bone, and here is the foramen magnum. Yes, okay. Prominent on the basilar part of the occipital bone is the pharyngeal tubercle, bony tubercle for the attachment of part of the pharynx to the base of the skull. Pharyngeal tubercle, it should be somewhere here, but it's not. We cannot see it, so I don't know, but it should be there. Yeah, pharyngeal tubercle. Yeah, but okay, the professor says pharyngeal tubercle should not be here, it should be here, but okay, I don't know. The book says pharyngeal tubercle is here, which doesn't make sense, but okay. Immediately lateral to the basilar part of the occipital bone is the petrous part of the mastoid part of the east temporal bone. We've seen this, wedge-shaped in this appearance with its apex anteromedial, and its petrous, and the petrous part of the temporal bone is between the greater wing of the sphenoid anteriorly and the basilar part of the occipital bone posteriorly. The apex forms one of the boundaries of the foramen lacerum, an irregular filling filled in life with cartilage. So foramen lacerum is at the apex of this part of the temporal bone, which we can see. The other boundaries of the foramen lacerum are the basilar part of the occipital bone medially and the body of the sphenoid anteriorly. Are the basilar part of the occipital bone medially. and the sphenoid bone anteriorly posterior lateral from the foramen lacerum along the buttress part of the temporal bone is the circular opening for the carotid canal. Yeah, carotid canal. This one. Let me just erase everything. This is the carotid canal, and this is the jugular foramen. Carotid canal here, jugular foramen here. Between the petrous part of the temporal bone and the greater wing of the sphenoid is a groove for the cartilaginous part of the pharyngeal tympanic tube, auditory tube. This groove continues posterolaterally into a bony canal and the petrous part of the temporal bone for the pharyngeal tympanic tube. Auditory tube, groove for the auditory tube is here, anterior to the petrous part. This is the foramen lacerum. This is the petrous part of the temporal bone, and here is the groove for the auditory tube. Just lateral to the greater wing of the sphenoid is the squamous part of the temporal bone, participates in the temporomandibular joint, contains the mandibular fossa, which concavity with the head of the mandible articulated in the base of the skull. An important feature, prominent articular tubercle, which is the downward projection of the anterior border of the mandibular fossa. Articular tubercle. So mandibular fossa, articular tubercle. Yeah. Which helps in the formation, it not helps, it is in the formation of the temporomandibular joint, TMJ. Posterior part of the base of the skull extends from the anterior edge of the foramen magnum. Posterior part of the base of the skull extends from the anterior edge of the foramen magnum posteriorly to the superior nuchal lines. It consists of part of the occipital bone centrally and the temporal bone laterally. We have seen this. Occipital bone is the major bony element of this part of the base of the skull. It has 4 parts organized around the foramen magnum, which is a prominent feature of this part of the base of the skull, and through which the brain and the spinal cord are continuous. The parts of the occipital bone are squamous part, which is the posterior to the foramen magnum, the lateral part which is lateral to the foramen magnum, and the basilar part which is anterior to the foramen magnum. Basilar part, posterior part, and lateral parts. Oh, sorry, this is the squamous part. Squamous and lateral parts are components of the posterior part of the base of the skull. Most visible feature of the squamous part of the occipital bone when examining the inferior view of the skull is the ridge of bone external occipital crest, which extends down from the external occipital protuberance toward the foramen magnum. The inferior nuchal lines arc laterally from the midpoint of the crest. So this is the crest. External occipital protuberance. This external occipital crest. This one. Inferior nuchal line, superior nuchal line. Immediately lateral to the foramen magnum are the lateral parts of the occipital bone, which contain important structural features. On each anterior lateral border of the foramen magnum are the rounded occipital condyles. We've seen this. These are articulation with C1. Yeah. Articulated with the atlas C1. Posterior to each condyle is a depression, the condylar fossa containing a condylar canal. And anterior and superior to each condyle is a large hypoglossal canal. Lateral to each hypoglossal canal is a large irregular jugular foramen formed by the opposition of the jugular notch of the occipital bone and the jugular notch of the temporal bone. Okay, so condylar canal, hypoglossal canal, and the jugular notch. Jugular notch, jugular foramen. Hypoglossal canal is inside here. That is the occipital condyle. I have also seen but okay, I think it's coming here. Okay, this is the jugular foramen here, hypoglossal canal here. Okay, this is surprising, but fine, I would say. Okay, Jugular notch we've seen, jugular foramen we've seen, hypoglossal canal we've seen, condylar fossa, condyle. Okay, let me find it. Condylar fossa. Okay, so this is the occipital condyle, and somewhere here should be the condylar fossa or condylar canal. Yeah, condylar canal is there, right beside the occipital condyle, condylar canal. Laterally in the posterior part of the base of the skull is the temporal bone. Parts of the temporal bone seen in this location are the mastoid part of the petromastoid part and the styloid process. Posterior part of the base of the skull is the temporal bone. Parts of the temporal bone seen in this location are the seen in the posterior half of the inferior. The lateral ridge of the mastoid part is identified by the large cone-shaped mastoid process projecting from its inferior surface. This prominent bony structure is the point of attachment for several muscles. On the medial aspect of the mastoid process, mastoid process is, yeah, it's important, deep mastoid notch, which is also an attachment for the muscle. Anterior medial to the mastoid process is the needle-shaped styloid process projecting from the lower border of the temporal bone. Styloid process, yeah, numerous muscles and ligaments. Finally, between the styloid process and the mastoid process, the stylomastoid foramen. Cranial cavity. Cranial cavity is a space within the cranium that contains brain, meninges, proximal parts of the cranial nerve, blood vessels, and cranial venous sinuses. The calvaria is the dome-shaped roof that protects the superior aspect of the brain. It consists mainly of the frontal bone anteriorly, the paired bone parietal bones in the middle, and the occipital bone posteriorly. Sutures visible internally include the coronal suture between the frontal and parietal bones. We've seen the sagittal suture, lambdoid suture. We've seen visible junction of these structures of the bregma, where the coronal and sagittal sutures meet. Yeah, and the lambda. We've seen other marking the internal surface of the calvaria include bony ridges and numeral ridges and pits, grooves and pits. From anterior to posterior features seen in the bony roof of the cranial cavity are middle ridge of the bone extending from the surface of the frontal bone, the frontal crest here, and the point of attachment for the falx cerebri. We don't need to know this right now. Dura mater, yada yada. At the superior point of the terminal of the frontal crest, the beginning of the groove for the superior sagittal sinus, which widens the termination of the frontal crest at the beginning of the groove for the superior sagittal sinus, which widens and deepens posteriorly and marks the position of the superior sagittal sinus and intradural venous structure. Groove for the superior sagittal sinus. This. Either side of the groove, the superior sagittal sinus throughout records a small number of depressions, granular foveolae, which mark the location of arachnoid granulations. We don't need to know this. Prominent structures. Examine the arachnoid granulations are involved in reabsorption of CSF. Granular foveolae. On the lateral aspect of the roof of the cranial cavity, smaller grooves created by various meningeal vessels. Floor. The floor of the cranial cavity is divided into anterior, middle, and posterior cranial foveae. Fossae. Anterior cranial fossa. Frontal, ethmoid, and sphenoid bones form the anterior cranial fossa. The floor is composed of the frontal bone in the anterior and lateral direction. Yeah, this one. Ethmoid bone here, and the two parts of the sphenoid bone posteriorly, the midline and the lesser wing, which we could not see from outside. Now we can see from the inside. Lesser wing. Anterior cranial fossa is above the nasal cavity in the orbis and filled by the frontal lobes of the cerebral hemispheres. Yeah, anteriorly small wedge-shaped midline crest of the bone. The frontal crest projects from the frontal bone. This is a point of attachment for the falx cerebri. Immediately posterior to the frontal crest is the foramen cecum. Here, this formation between the frontal and ethmoid bones may transit emissary veins connecting the cranial cavity with the superior sagittal sinus. Just a second. Okay, I'm back. Sorry for that. Okay, Posterior to the frontal crest is the prominent wedge of the bones projecting superiorly from the ethmoid crista galli, another point of the attachment for the falx cerebri, which is the vertical extension of the dura mater. Dura mater, yeah, we don't need to know this, but the crista galli we need to know. This foramen of the cribriform plate, and this is the crista galli. This, and this is the anterior part, labeled here. Lateral to the crista galli is the cribriform plate of the ethmoid bone. This is a seal-like structure which allows bone to pass through. This allows the cranial nerve 1 to pass through. Olfactory nerve 1. Olfactory nerve CN1. On each side of the ethmoid, the floor of the anterior cranial fossa is formed by relatively thin plates of frontal bone, the orbital part of the frontal bone, which also forms the roof of the orbit below. This orbital part, so right directly inferior to this area are the eyes or the orbital cavity. Posterior to both the frontal and ethmoidal bones, the rest of the floor of the anterior cranial fossa is formed by the body and anterior wings of the sphenoid. Body and lesser wings of the sphenoid. In the midline, body extends anteriorly between the orbital parts of the frontal bone to reach the ethmoid bone, and posteriorly extends to the midline cranial fossa. This is description. Yeah, we've seen everything. Boundary between the anterior and middle cranial fossa in the midline is the anterior edge of the chiasmatic sulcus, a smooth groove stretching between the optic canals across the body of the sphenoid. Is the chiasmatic sulcus. Yeah, okay, but this one, chiasmatic sulcus. Lesser wings of the sphenoid. Two lesser wings of the sphenoid project laterally from the body of the sphenoid and form a distinct boundary between the lateral parts of the anterior and middle cranial fossae. Lesser wings of the sphenoid. Two lesser wings of the sphenoid project laterally from the body of the sphenoid and form a distinct boundary between the lateral parts of the anterior and middle cranial fossae. Overhanging the anterior part of the middle cranial fossa, each lesser wing extends laterally as a sharp pointed junction between of the frontal bone and the greater wing of the sphenoid near the upper lateral edge of the superior orbital fissure that is formed between the greater and lesser wings. Yeah, superior orbital fissure we have not seen, but we will. Medially, each lesser wing widens, curves posteriorly, and acts a rounded anterior clinoid process. These processes serve as the anterior point of attachment for the tentorium cerebelli, which is the sheet of dura. We don't need to know this. Just anterior to each clinoid process is the circular opening in the lesser wing of the optic canal of the sphenoid optic canal, through which the ophthalmic artery optic nerve 2 passes the exit the cranial cavity to enter the orbit. Optic canals are usually indicated in the middle cranial fossa. Yeah. So here are the optic canals. And this is what they were talking about, the anterior clinoid process, rounded posterior part of the sphenoid body, the lesser wings of the sphenoid. Middle cranial fossa consists of parts of the sphenoid and temporal bone. Boundary between the anterior and middle cranial fossa is the anterior edge of the chiasmatic sulcus, as we have seen, which is a smooth groove stretching between the optic canal across the body of the sphenoid. The posterior boundaries of the middle cranial fossa are formed by the anterior surface, as has the superior border of the petrous part of the petromastoid part of the temporal bone. Sphenoid floor in the midline of the middle cranial fossa is elevated and formed by the body of the sphenoid. Lateral to this are large depressions formed on either side by the greater wing of the sphenoid and the squamous part of the temporal bone. These depressions contain the temporal lobes of the brain. Yeah, these depressions. And here as well. Sella turcica. Yeah. Turkish saddle. This part. Just posterior to the chiasmatic sulcus is generally modified remainder of the body of the sphenoid, the sella turcica, which contain deep central area, the hypophyseal fossa. This one. In the pituitary gland with anterior and posterior vertical walls of bone. The anterior wall of the sella turcica is vertical in position with its superior extent visible as a slight elevation, tuberculum sellae. The anterior elevation is tuberculum sali, the posterior is the dorsum sali. Posterior edge of the chiasmatic sulcus, lateral projection from the corner of the tuberculum. The middle clinoid processes are sometimes evident. Middle clinoid processes. Can we see them here? Oh yes, these are small middle clinoid processes. Posterior wall of the sella turcica is dorsum sali. Okay, yeah, dorsum sali, we have seen it. A large ridge of bone projecting upward and forward. At the top of this bony ridge, the lateral edges contain the rounded projections, the posterior clinoid processes, which are points of attachment, like the anterior clinoid process for the tentorium cerebelli. Posterior clinoid process is here. Clinoid processes are just rounded elevations. That's it. Yeah, we don't need to know tentorium cerebelli and falx cerebelli, blah blah blah. Fissures and foramina lateral to each side of the bony of the sphenoid. The floor of the middle cranial fossa is formed either by the grid wing of the sphenoid, diagonal gap, superior orbital fissure. This. No. Yeah, this is the superior orbital fissure, and here are the optic canals. Yeah, optic canals. Grid wing of the sphenoid from the lesser wing and is a major passageway between the middle cranial fossa and the orbit. Passing through the fissure are the oculomotor nerve, trochlear nerve, ophthalmic nerve, and the abducent nerve and ophthalmic veins. There's a table. This one. No, where did it go? This one. This is also extremely important. The professors will ask you this. Posterior to the medial end of the superior orbital fissure on the floor of the middle cranial fossa is a rounded foramen, the foramen rotundum, which is maxillary nerve V2, foramen rotundum, large opening, oval opening, foramen ovale, superior orbital fissure, foramen rotundum, and foramen ovale, V1, V2, and V3, and foramen spinosum, something I forgot, but yeah, these are the openings you must know. All of these you must know as well, don't get me wrong, which allows structures to pass between the extracranial and infratemporal fossa and the middle cranial fossa. The mandibular nerve V3, lesser petrosal nerve carrying fibers from the tympanic plexus, originally come from the mandibular nerve V3, lesser petrosal nerve carrying fibers from the tympanic plexus, originally come from the glossopharyngeal nerve, and occasionally a small vessel, the accessory meningeal artery, pass through this foramen. This is just description. In the table you just have to memorize it, there's no logic. Posterior medial from the foramen ovale is the small foramen spinosum. This opening also connects the infratemporal fossa with the middle cranial fossa. The middle meningeal artery and associated vein pass through this foramen. Yeah, so this is what I was talking about. Once inside the groove for the middle meningeal artery across the floor and lateral wall of the middle cranial fossa clearly marks their path. Posterior medial to the foramen ovale is the rounded intracranial opening of the carotid canal. Directly inferior to this opening is an irregular foramen, foramen lacerum, clearly observed in the inferior view of the skull. Foramen lacerum is closed by live cartilaginous plaque and no structures pass through it completely. Yeah, so this is a description of the images. Temporal bone. The posterior boundary of the middle cranial fossa formed by the anterior surface of the petrous part of the petromastoid part of the temporal bone. Medially, there is a slight depression, trigeminal impression, in the anterior surface of the petrous part of the temporal bone. Trigeminal impression 8.26. Here is the trigeminal impression. In the anterior surface of the petrous part of the temporal bone, which marks the location of the sensory ganglion for the trigeminal nerve. Yes. Lateral to the trigeminal impression and on the anterior surface of the petrous part of the temporal bone is a small linear groove that passes in the superior lateral direction and ends in the foramen. The groove and hiatus for the greater petrosal nerve. Greater petrosal nerve is a branch of the facial nerve. Groove and hiatus for the greater petrosal nerve. And here is the groove and hiatus for the lesser petrosal nerve. Anterior lateral to the groove for the greater petrosal nerve is a second smaller groove hiatus for the lesser petrosal nerve branch for the tympanic plexus carrying fibers originally come from the glossopharyngeal nerve. Yeah, this is important. Above and lateral to the small opening for the greater and lesser petrosal nerve near the superior ridge of the petrous part of the temporal bone, a rounded protrusion bone, the arcuate eminence is produced by the underlying anterior semilunar canal of the inner ear. Arcuate eminence. this. So inner ear produces this arcuate eminence. This is 50-50. I don't think it's extremely important, but still. Okay, just anterior and lateral to the arcuate eminence is an anterior surface of the buttress part of the temporal bone is slightly depressed. This region is the tegmen tympani, marks the thin bony roof of the middle ear cavity. Tegmen tympani is this. So here is the tegmen tympani, middle ear, inner ear, and the outer ear is outside. The posterior cranial fossa consists mostly of parts of the temporal and occipital bones with small contribution from the sphenoid and parietal bones. It is the largest, deepest of the three cranial fossa and contains the brain stem. We don't need to know this, and the cerebellum. Boundaries. The anterior boundaries of the posterior cranial fossa and the midline are the dorsum salia and the clavus. Clavus is this thing. Yeah, this is the posterior cranial fossa. Cleavage is a slope of bone that extends upward from the foramen magnum. It is formed by contribution from the bone of the sphenoid from the basal part of the occipital bone. Laterally, the anterior boundaries with the anterior cranial fossa, the superior border of the petrous part of the petromastoid part, the squamous part of the superior part of the petrous, blah 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 blah. Okay, this is his description. So yeah, posteriorly the squamous part of the occipital bone is the level of the transverse groove is the major boundary, while laterally the petromastoid part of the temporal bone and small parts of the occipital and parietal bones border the fossa. Foramen magnum, centrally deepest part of the posterior fossa is the foramen magnum. Foramen magnum surrounded by the basilar part of the occipital bone, lateral parts of the occipital bone. Spinal cord passes inferior through the foramen magnum, also passing through the foramen magnum of the vertebral arteries, which is important. I screwed this up before. Meninges and the spinal roots of the accessory nerve, grooves in the foramen. A cleavage slopes upward from the foramen magnum. Lateral to the cleavage is a groove for the inferior petrosal sinus. Between the basilar part of the occipital bone and the petrous part of the petromastoid part of the temporal bone. Groove for the inferior petrosal sinus. Laterally across the upper half of the posterior surface of the petrous part of the temporal bone is an oval foramen. Internal acoustic meatus. We've seen the facial and vestibulocochlear nerves and the labyrinthine artery pass through it. Internal acoustic meatus here, and outside is the external acoustic meatus. Inferior to the internal acoustic meatus is the temporal bone, separated from the occipital bone by a large jugular foramen. Leading to this foramen from the medial side is the groove for the inferior petrosal sinus, and from the lateral side is the groove for the sigmoid sinus. Jugular groove for the sigmoid sinus, and medially groove for the inferior petrosal sinus. Sigmoid sinus passes into the jugular foramen as continuous with the internal jugular vein, while the inferior petrosal sinus empties into the internal jugular vein in the area of the jugular foramen. The sigmoid sinus, sigmoid sinus becomes an S and ends at the jugular foramen, while the inferior petrosal sinus empties in the jugular vein and also the area of the jugular foramen. Also passing through the jugular foramen are the glossopharyngeal, vagus, and the accessory nerve. This is summarized in the table. You just have to memorize it. No explanations. Medial to the jugular foramen is a large rounded mound of the occipital bone, the jugular tubercle. Just inferior to this, the inferior superior to the foramen magnum is the hypoglossal canal. Yeah, hypoglossal canal, we've seen this. Through which hypoglossal nerve leaves the posterior cranial fossa, and the meningeal branch of the descending pharyngeal artery enters the posterior cranial fossa. Just posterior lateral to the hypoglossal canal is a small condylar canal that, when present, transmits an emissary vein. Yeah, but condylar canal from the other side. Yeah, it should be here, right beside the condyles. But yeah, I don't know. Squamous part of the occipital bone. Squamous part of the occipital bone has several prominences running upward in the midline from the foramen magnum is the internal occipital crest. We've seen this internal occipital crest. On either side of the internal occipital crest, the floor of the posterior cranial fossa is concave and accommodated the cerebral hemisphere is the internal occipital crest, and superiorly in a bony prominence, the internal occipital protuberance. Internal occipital protuberance. This one, it ends here, and the transverse sinus and sigmoid sinus start. Extend laterally from the internal grooves produced by the transverse sinus will continue laterally, eventually joining a groove for each sigmoid sinus. One of these grooves then turns inferior towards the jugular foramen. Each of these grooves, the transverse and sigmoid sinuses, are intradural venous sinuses, foramen and fissures through which major structures enter and leave the cranial cavity. Foramen and fissures through which major are summarized in figure 3.28. Extremely important. And we're done for today. Thank you so much for listening, and I'll just now the understanding is done. Now comes the memorization part. See you in the next video.